everyone, I'm Raina Eshelman with Mountain View Fire Rescue. We're going to go over some common features of AEDs, or automated external defibrillators. This is one model that you may find out in your community, at your gym, your grocery store, your office, or a similar public area. We're going to go over some features. First of all, when you start to use the AED, the first thing you want to do is open it up, remove the lid. First thing you'd want to do is hit the on button and turn it on. Most AEDs will run through a startup sequence where lights may flash and there'll be beeping or audible sounds to guide you, so hit the on button first. Then there's a cord that plugs into the AED, which we'll do in a moment, and a set of defibrillation pads. Now this particular model has the pads connected in the center with an X marks the spot to show you where to put your hands for chest compressions. Not all models that you may encounter out in the community will have the pads connected like this, so don't be surprised if you open up the AED and these two pads are separate. That's totally fine. We do want to point out that any model that has the pads connected like this, the pads are detachable. There are perforated lines right here that you could just pull the pad completely off the center there. If you had a particularly large individual and you needed more space to get them into the right position, or for any other reason that you needed to separate the pads. Okay? So today we'll just show you how this works with the pads attached. So bottom line is all AEDs are going to show you pictures right on the pad of where to place it on your patient. Okay? Before you can place the pads properly, you want to make sure that your patient's chest is bared. If it is a female patient, it is okay to remove the shirt and the bra if you need to save a life. Okay? We also want to make sure the chest is dry. If you need to wipe down the chest to get rid of perspiration or water or any sort of medication patches that might be in the way, go ahead and do that with a gloved hand or with a towel or even a t-shirt. Okay? And then just follow the pictures. So when you're done, there should be one pad that's on the patient's upper right in this part of their chest, and the other pad goes around, we'll just show you here, to the patient's lower left side of their torso. Okay? All right? So you're going to attach the pads by peeling off an adhesive back, just like putting a decal onto your water bottle or your car. Peel off the adhesive back and then stick it firmly onto the patient's chest. Okay? If you do have a patient that has a significant amount of body hair in those areas where you need to put the pads, a lot of AEDs will come with a small razor. It kind of looks like a book of matches, and you may need to remove some hair from those contact points in order to get good contact. Go ahead and plug it in. You want to plug it in last, because as soon as we plug in the AED cord to the machine, it will start to try to read a heart rhythm. Okay, so do that last. Once it's plugged in, you're just going to follow the auditory and visual prompts on your particular AED. So, things you may hear at this point, once you've plugged it in, the AED will likely say something like, stand back, analyzing now. That's when you want to make sure that no part of your body, not your legs, not your hands, or any other bystanders, are touching the patient. Let the AED do its analyzing of the heart rhythm, and if it decides that your patient needs defibrillation, it will tell you that. You'll hear the battery charging up. It sounds like this. Boop, beep, 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 or something similar. And then it will say, shock advised, or deliver shock, or something like that. This particular model has a defibrillation button right in the center. This will flash. Any model that you're using will have a red button or a red light or something that clearly says shock. You're going to make sure everyone is clear, not touching the patient head to toe, then push the shock button. The machine will deliver a shock. Once that's done, then you'll go right back to your CPR cycles of 30 and 2, as we saw in the previous video. We do want to point out that AEDs are very safe and that under no circumstances would this machine deliver a shock to someone who does not need it. That's a common misconception among the public, so be very assured that if the machine says the patient needs a shock, they need it. If they don't need a shock, the AED will not advise you to push the shock button. First thing you want to do is remove the lid. The next step is to hit the on button
Unit OK.
and turn your AED on.
Stay calm.
Okay.
Check responsiveness. Call for help.
So we've already done those
Attach
steps.
defib pads to patient's bare chest.
We're going to peel the adhesive back off and attach the pads, as you'll see in the rest of the video.
Attach defib pads to patient's bare chest.
Okay, we've done that. Now we're going to plug in the connector. So the correct order is turn the machine on, then place the pads,
Attach defib pads to patient's bare chest.
then plug in the connector.
Don't touch patient. Analyzing.
We're going to stand clear, make sure everyone's clear head to toe while the machine analyzes.
Don't touch patient. Analyzing. Shock advised.
Okay, shock advised.
Don't touch patient. Press flashing shock button.
Okay, clear, clear, I'm clear, you're clear, shocking.
Shock delivered. Start CPR.